Hello, my name is Luna Albizri, and today I'm pleased to present to you a new CPD Bites discussing the antimicrobial resistance and sustainability in pharmacy. I hope by the end of this CPD Bites that you're going to understand the connection between antimicrobial resistance and sustainability, to identify opportunities for pharmacists to increase awareness and take an active role in promoting sustainable practices to combat AMR. We're going to split our CPT bites into three parts. First, we're going to understand what is the relation between sustainability and AMR. Number two, we're going to see the environmental impact on AMR. And finally, we're going to discuss the role of pharmacists in addressing AMR through sustainable practices. So let's first understand what are the principles of sustainability. In fact, we do have three principles. The first is the environmental sustainability, which focus on preserving and nurturing the health of our planet. The social sustainability focuses on promoting equitable and inclusive community, while the third and the last principle, the economic sustainability, revolves on cultivating a resilient and flourishing economy that serves both the present and future generations. Medicine, in fact, should be used responsibly, equitably, and efficiently to meet present therapeutic needs without compromising future effectiveness. What do we understand by responsibly? Well, responsible use is the use of medicines appropriately to avoid misuse and resistance. The equitable use is to ensure fair and inclusive access for all populations. Finally, the efficient use is based on optimizing resources and reducing waste in medicine use. So, as we have seen, pharmaceuticals and medicines are important for the prevention and treatment for symptoms and diseases. However, the problem is that 4.6% is the healthcare's share of global gas emission. 25% is the share of the pharmaceuticals of healthcare's total emissions. 50 to 80% gas emission from the drug supply occurs at the level of the upstream suppliers. So we do have a very important problem concerning our environment. So antimicrobial resistance constitute a global triple threat. One is on the environment, the second on the economic systems, and the third on the human health. During the CPD bites, we're going to focus on the threat caused on the environment. So most antimicrobials enter the environment through different ways and pathways. We're going to see what are these ways. First, we do have the first pathway is the one that is happening from the manufacturing process. The release of the waste of the antimicrobials and the antimicrobials are from industrial production. They're going to reach the wastewater and they're going to be treated. And then they're going to contaminate our soil and water. Another pathway is the animal and agricultural way through the livestock treatments and even the companion treatments of animals. Those two also will reach from their excretions, the soil and the water, and they will contaminate them. Finally, we as a human, if we are taking antimicrobials, they're going to reach the soil and the water. The inappropriate disposal of medicines is also going to raise the antimicrobial resistance. Then the use of antimicrobial is very critical if it is used inappropriately through overusing or misusing. We're going to create the case of the rising of resistant germs. these resistant germs that are going to soil and contaminate our environment will have a negative effect. The unsafe disposal of waste of antimicrobials is going also to increase the problem. So we have this contamination of the soil and the water. Unfortunately, we have a horizontal transfer of resistant genes between the animal, your humans, and the environment. And thus, we will have this contamination among not only the soil and the water, but also the human and the animals, and the rise of the resistance of these microbes. For these reasons, and for different other reasons contributing to the rise of antimicrobial resistance, the World Health Assembly in 2015 has adopted the AMR Global Action Plan to respond to the threat caused by AMR and its impact, of course, on people's life and livelihoods. The AMR Global Action Plan is built on 5 pillars. The first one is about raising awareness and understanding through effective communication, education, and training. The second one is to strengthen the knowledge and the evidence through increasing method of surveillance and research. The third one is to reduce the incidence of infection through effective sanitation, hygiene, and infection prevention measures. The fourth pillar is to optimize the use of antimicrobial medicines in human and animal health as well. The last one is to ensure sustainable development. How? By increasing the sustainable investment that takes account of the needs of all in countries and increasing investment in new medicine, diagnostic tools, and vaccines. So, where are these gaps and what are these gaps? First, unfortunately, we do have dispensing without prescription. This is happening mostly in low and middle income countries. We do have in many countries a lack of a program to have a medication return or a safe disposal systems. Unfortunately, as we have seen before, the carbon footprint of supply chains is really bad and cold chain are insufficient. Finally, we need badly to improve the public and patient education on antimicrobials. So, how can we, as pharmacists, help really and to be part of the solution to increase and to address the problem of AMR and sustainability? Well, first, we can leverage digital technology by adopting e-prescription, by using medical health records, by using mobile application, we can monitor prescription and be sure the right antimicrobial has been used. We can remind our patients to adhere to their treatment and to take the full course of this treatment. We will make sure that we don't have an overstock about antimicrobial, and thus we will have a problem for returning products or expired products and an unsafe disposal. Number two, we can increase environmental health literacy and green skills of all parts and of the stakeholders, the healthcare professionals, the patients, and the community. We can increase, we will have to play the role of educators to let them understand how antimicrobial resistance is impacting our environment. What are the good green practices that we have to adapt and adopt? Finally, we can reduce the environmental impact of medicines from procurement to disposal. And we're going to detail this in our next slide. So let's see what we can do. First, we have to say a very important statement. It is very important to prevent waste rather than treating or cleaning of if it, after it has been created. So we have to work more on sustainable manufacturing process, on green chemistry principles, less hazardous chemical synthesis. So this is at the level of the manufacturer. What about hospital pharmacists? We have to develop a pharmaceutical waste program that nurses and other staff who handles medicines can easily understand and follow. And of course, hospitals must establish an AMS program where there is surveillance and research and follow for the use of antimicrobials. At the level of the community pharmacists must also establish AMS programs where also surveillance is an item to adapt and adopt. They have to be educators to educate patients about resistance and proper use of antimicrobials because we don't want them to abuse or auto-prescribe antimicrobials, not to adhere to their treatment. So, sustainable pharmacy practice is very important. As we have said, digital prescribing and e-dispensing to reduce waste, refillable and reusable packages, and finally, medication return programs. In conclusion and in summary, one solution is to create less waste. And pharmacist has to collaborate with others and to coordinate with all stakeholders involved in AMR fighting. So pharmacists must be an active part of the One Health team and to engage with all their stakeholders. Number two, we have the role to be educator and to empower our patients and community. We have to let them to understand what are the consequences of antimicrobial auto-prescription or misuse, the importance of implementing infection prevention control measures. Finally, the establishments and implementation of antimicrobial storage programs is very crucial at all levels, the hospital, the community, and others. We are responsible to train and educate pharmacists about the proper use of antimicrobials. We have to raise the importance and to be educated on AMR surveillance. And finally, we have to find points of collections of expired or unused medications, in particular for our antimicrobials. Thank you very much. I hope that you have enjoyed my CPD bites. If you need more references, these are references, further references. And see you in next time. Goodbye.